atrial fibrillation.
The following is an imaginary discussion between a doctor and his patient concerning a diagnosis of atrial fibrillation.
Good morning, Mrs. Stevens, how are you?
Good morning, doctor, I'm okay, it's been a crazy day.
All right then, you told me you had the swollen feet, right?
No, it's my legs.
Oh yes, the swollen legs. When I was listening to your heart I heard all these extra beats. Are things all right now?
I don't feel anything different.
You don't feel any palpitations or anything like your heart racing or anything?
No.
Okay, so we did your EKG, hold on, let me get a previous one so we can compare the two, that way you can easily see what's going on.
All right.
Okay, this is your old EKG, and, you can see how the beats are regular.
Yes, just a second, let me just switch my glasses.
Excuse me?
Yeah, so I can see what you're talking about.
You want to put on your glasses, okay.
Right.
Look over here and see how the beats are consistently regular, and they continue, one after another, same shape, see how they are all spaced out nicely?
Nice and even, yes.
And equally?
Uh-huh.
All right, now let's take a look at today's EKG. We can see how you have a beat, you have another beat, and then this one's wider.
Right.
This one is wider, while this one is narrower. Now they are becoming a little narrower.
Uh-huh.
And now, they get a little wider, all right?
Yes.
So that kind of heart rhythm is what's called atrial fibrillation.
Uh-huh.
It's a very common rhythm and a lot of people get it later in life.
Okay.
So what does it mean?
Well, it probably means that I have a heart problem.
What it means is that, well, most people could live fine with this rhythm and not have any problem, but it may lead to swelling in the legs because heart isn't beating properly.
Oh, I see, it's not pumping correctly.
That's right.
Yes.
What it means is that the fluid accumulates in your legs, it's not circulating around the body.
Oh, right, right.
All right, so, and the other thing that is even more important, what it means is this, that people who have this kind of rhythm have an increased risk of experiencing a stroke.
Oh, that's not good.
And we recommend that people who have this type of rhythm go on blood thinners.
No, I don't want to do that.
But you must, because if you don't take the blood thinner you may get a stroke, that's the thing. So, what do we do about it? Well, it is definitely recommended that we start you on a blood thinner.
Uh-huh.
And, another thing, I would like to refer you to go see a cardiologist to do some tests on your heart and to see how it's pumping. You know, it is the test where they put some jelly on you, it's like the echo, the sonogram.
Oh yeah.
Like they do with babies to see how it's pumping.
Yes.
And then, sometimes they might want to try some medicines, to see if your heart goes back into the normal rhythm, you know.
Uh-huh.
I can see that you already take a medication they use for this, and actually, your heart rate is not that fast, meaning that it's okay right now, you're not in any danger.
Oh, okay, that's good.
However, the only thing is, you know, the stroke.
Right.
So, I would recommend you take a medicine to prevent a stroke.
So that's, yeah, we don't want that to happen.
Well, there's a couple of ways to treat it. One is the medicine called blank. Did you ever hear of blank?
Yes, I know, one of my friends take it.
All right, perhaps they have what you have.
I'm not sure.
Because this is very common.
Uh-huh.
Now the problem with blank is, you have to monitor your blood levels, it's a pain in the neck.
Right.
I must add that there are some newer medicines out there that you don't have to monitor your levels, you just take the medicine and, that's all you do. So I like to use the new medicines because this way you don't have to get involved with monitoring your blood tests.
Right.
These medications are very convenient, especially when you are gone on vacation, or out of the house for any length of time.
Right, that makes sense. And what is it, a pill?
Yes, it is a pill you take.
And, what are the disadvantages?
Side effects?
Yeah.
Most people don't have any side effects. It could cause easy bruising because it is a blood thinner.
Okay, and what is it about blood thinners that is a problem? I hear people saying things like,
well, blood thinners, you don't want to fall and hit your head.
oh yes.
Yes, because it causes easy bleeding.
Yes.
It causes nosebleeds.
Uh-huh.
Things like that.
Mm-hmm.
And blank medication is inexpensive. However, it can be a problem. Blank is cheap. That's why some people still use it. The newer ones are a bit more expensive, but you don't have to monitor your blood. If you're on the blank medication, you would have to come back every few days to get your blood tested initially, and then after that every single month.
I see.
And that is why I recommend you go on one of the new medicines.
Now, does that change my graph, this EKG you are showing me? Would it change if I came back next week?
It may. Your heart may go back into its normal rhythm.
That's what I'm wondering.
It's possible.
Would it change?
It is possible that it may change. It is also possible it may continue in this rhythm.
Oh.
So yes, look here, it has been regular all along and I never heard those extra beats before. That's why I got a little concerned.
Because it was all right all along?
I am quite sure that is why you got the swelling in your legs all of a sudden.
Like I said, this has been a crazy day.
It is likely that your heart wasn't pumping the way it should be. Yeah?
I see. And then when I drink a lot of water and I keep going to the bathroom and then I put my legs up on 2 pillows.
Yes.
It all comes down.
Well, that makes sense.
It is very strange. Why should it change now? Nothing else has changed.
Yes, your previous EKGs were all good. However, your heart might have changed. The heart could all of a sudden not pump as well as it's supposed to.
I thought it was like, what do they call it? It is when people fill up with fluid and then they...
Well, if the heart doesn't pump as well as it can, if it becomes out of control. However, for yours, there is a rhythm. The rhythm is not normal but the pumping and the rate of the rhythm is okay. If the rate gets out of control then you could fill up with fluid.
Yes, I just don't know. I'm not a pill taker.
You don't know what to do?
Very much, and I don't want to ever have anything wrong with me. I just want to be like I am until the day I die, but I guess it doesn't work like that.
I wish it did. Okay, what to do? Well, if the thing with taking their medicine is this: if you don't take the blood thinner you are not guaranteed to have a stroke. However, you do have a very high incidence of getting a stroke.
Right.
Having a stroke is possible, and by taking the medicine it reduces that possibility.
I see.
Well, if you don't want to take the blood thinner you should definitely keep taking the aspirin.
It's a baby aspirin.
Although it's a blood thinner, it is certainly not as good as the medications that we have available.
Should I take one a day?
One a day.
Well, can I come back and take another EKG in a certain amount of time and see if it changes any?
You can. You could come back, maybe on Friday.
Well, Friday I'm going to the eye doctor.
Right.
So I'll come back like a week later.
All right, so come back in a week and make sure you take that aspirin every day.
Yes, I will.
And you're already taking the blank medication.
Oh, that's right, and the other drug is, that's the one I forget the name of it.
There is another medicine I could put you on to help the heart pump a little bit better. Which may make the rhythm go back to normal. If you want to try that we could do that.
Well, what if we just think about taking it again after?
All right.
Then I'll consider taking it.
So, we'll see you in a week, and if you change your mind about taking the blood thinner, let me know.
Uh-huh.
Because I could always give you samples of it.
Uh-huh.
And, we could start that.
Uh-huh.
You could think about it and you let me know.
Okay.
Talk to your friend. I'm sure half your friends have the same type of thing.
And what is it that you call it again? A fibrillation.
Atrial fibrillation.
Atrial, okay.
Let me write it down for you.
So what about these legs swelling up? Is there anything I should do for them?
You know that, just keep them elevated. So, it is atrial fibrillation, and it is spelled A-T-R-I-L atrial and then fibrillation F-I-B-R-I-L-L-A-T-I-O-N.
Okay.
All right?
Yes, I see. I was a medical secretary in my younger days, so I know many of these terminologies, and I'm thinking that I don't wish to take pills.
So think about it and you call me if you want to start the blood thinner.
Right.
Take the aspirin and, let me know.
And now we don't have a problem with the blood pressure anymore?
No, your pressure is normal.
So, I don't understand why this should happen if there...
Well, it is two separate things.
Oh, okay.
This has to do with the electrical pattern of the heart and how it pumps.
I see, okay. And the other question I was going to ask you is, do you have a no-salt diet?
I don't really have a no-salt diet.
No, well, all... No, well, all... No.